Hello and welcome to the Nursing Associate event, which has been organised by Cornwall and Devon Primary Care Training Hubs by myself, Emma Borders for Cornwall and Jo Sutton for Devon. Now, during this Nursing Associate event, we really want to try and help explain about the Nursing Associate role and what the training is involved. So we will start off by talking to Sarah Trewin, who is a lead practice nurse and has been through this whole experience with one of her was healthcare support workers, but completed their training nursing associate course in 2020 and has been a nursing associate ever since. So she can sort of share some of that experience. Then we'll speak to Rachel Timms, who is from Health Education England and works in the Southwest on nursing associates. So she can tell us a little bit about the role and the funding that is available. Then we have Tamsin Irvin from Truro and Penwith College, who's going to tell us a little bit about their course offer, and Lisa Marie Rowe from the University of Plymouth, who will tell us a little bit about their course offer as well. And at the Primary Care Training Hub, we have a podcast called Primary Care Spotlight, and we have done an episode on nursing associates. So you can go and listen to that episode. If you scan the QR code, you will find that episode there. But also if you go on Apple Podcasts, Spotify, or wherever you get your podcast, you'll be able to search for Primary Care Spotlight and listen to the nursing associate episode. So if you want to remind yourself of anything that we're going to cover today, or you want to share it with any colleagues, then that resource is there. And also, if you have any questions, you can pop them in the chat and we will answer them at the end. And myself and Jo are available for you to ask us any questions and contact us after this event if you do want to know more, or hopefully apply for the Training Nursing Associate course. So we're going to start this event by talking to Sarah Trewin, who is the lead practice nurse at Carnan Downs Surgery, and she's going to tell us a little bit more about her experience.
We already had GP trainees, and so we brought the nursing associate role had just come out. We hadn't run it in Cornwall yet with the GP in surgeries, and it came up. I think it came up on the Cornwall Health bulletin actually, and we talked about it. And I spoke with our now nursing associate about it, and together we thought that was a really good idea. So we put together a little bid to the GP partners, and they thought it was a great idea. They really wanted to help her, really wanted to help develop her. So there was a meeting that happened. We went ahead and listened to that with the practice manager that came with us. And there was an apprenticeship. I think she was really keen to stay within practice. So she didn't want to go off and do training somewhere else for 2 years and then come back in. So she was really keen to stay within practice, stay within our team and learn on the job. So that was this really did fit the bill really well. So I did a lot of reading around nursing associates and where they were coming from. And they weren't a lot in primary care at that time. So the job seemed to be more hospital focus, so it took a little bit of time to sort of work out where we were going with it. So all of that happened. She got on the course without any problems, and she started in 2018. Before she started, we as a nursing team, there's only 6 or 7 of us, six of us all the time, and then 7 who comes in occasionally. And we all sat down together and said, how are we going to manage this? Because it's a 2-year course. It's at level 5. It was going to entail her going off on sort of secondment for a few weeks at a time and coming back. And how are we going to manage that? Could we manage that? And what did the rest of the nursing team feel about it? Because if they didn't think that they could cope with it, then it had to be a team decision. Anyway, everybody wanted to support her, and we said, yeah, we would help with all of that. And so that was great. So the team were on board. They really wanted to help. It was a new challenge for all of us, really. So we thought about how this was going to affect us positively. We were thinking about upskilling the nursing team. We were thinking about how her new learning is going to affect us. At the time, we didn't have any student nurses. We didn't have student nurses coming into the surgery. So it was a new thing for us altogether with the learning. So she started, and I was her mentor at the time. So at the time, the mentorship has changed, hasn't it? So we've got supervision and assessors and supervisors now. And at the time it was still at mentorship. So I'd already done the mentorship module and everything, and I just upskilled with that. So I was her mentor. And then she was at the University of Plymouth. She really embraced the course. She did find it really difficult. It was really difficult for her. It was really challenging. There was a lot of hours. She's got 2 children. She was working. She had to up her hours to suffice the requirements, which she did, and she was doing loads of work behind the scenes. She really had to put a huge commitment into it, and she really did. So she, at the beginning, she did need quite a lot of support from me to help with the university side of things, with writing assignments and stuff, because she hadn't done that for a long time. So she needed a lot of support, but that was fine. And fitting it all in, she did that fine. It was a really great experience for us all, because she brought with her lots of new knowledge. She went off and did 2 or 3 different placements, and then came back, and to see her grow and her confidence grow from the healthcare support worker that she was to becoming a nursing associate was really great. She'd not ever worked in a hospital before, so when she went off and did her first placement, bless her, was on trauma for 6 weeks. So that was a real eye-opener for her. So she went off and did trauma, and then she came back, and her outlook on the way that as she was doing the training, and as she was becoming a more of an autonomous nurse. So it was just really lovely to see. Her confidence is something that was always a little bit on the low side, and she would always say that herself. So to have that background knowledge and to be bringing that back with her, it was just really lovely to see, and the whole team really embraced it. It was quite tough on us all. That's true to say, because as a lead nurse, I had to work out how we were going to backfill her hours. We had to work out how we could keep everything going while she was on placement. And we also had to, as we'd agreed at the beginning, we had to make sure that this healthcare support worker is not now a healthcare support worker. She's a trainee nursing associate. And our mindsets had to change, and how we're going to make sure that she gets everything that she requires in practice, in a busy practice, when people are trying to fit appointments in left, right and centre. How are we going to upskill her? So we did have to really think about that throughout the 2 years, and we did manage it. We did really manage it. I think one of the things that I did find difficult, because it was a fairly new role, is that there was not a great deal of support for people coming in and actually maybe sitting and mentoring her, other than myself and the team. So now we do have a really good offer with the primary care team, and I know that Emma's setting this up, that there's going to be some clinical skills coaches and things that will be able to sit and come in and support the trainee nursing associates during their clinics, so that it frees up the practice nurses' time, so that we're not having to spend so much time sitting in with her. Anyway, so she's now qualified. She qualified in 2020, just as COVID hit. And then the next challenge really was to find out what was she going to do, where was she going to sit within the team, and also educating the rest of the primary care team about her new role. Now she's not a healthcare support worker, she is a nursing associate, but she's not a nurse. She's not a healthcare support worker. So, and lots of people have found that tricky over the last couple of years to work out where she sits. And I've done a lot of work in sort of working out with the platforms and the standards, helping to teach people within our team what she can and can't do. Bit of misconception about, now that she's got a PIN number, she can go off and do everything in the world, everything that nurses can do. And obviously that isn't the case. So a bit of education around that, but also that we mustn't treat her as a healthcare support worker. So it's taken a little bit of time to embed all of that in. But I think now that she would say, and I definitely would say, and the team would say, it's been a really great move. And we really, really enjoy having her with us. And she, I think the quote that she says to me fairly regularly when I say, all right, everything okay? She said, pleased that you still did the training. And she says to me, it was absolutely brilliant and I love it, but it's not for the faint-hearted. I think the thing that the extra hours and all of the things you have to do, fitting around all of your life and all of the extra work you have to do and keeping your job, is a big challenge, but worth it.
Yeah, thanks so much, Sarah. Would you be able to just sort of tell people just very quickly what sort of thing she's doing now that she's qualified as a nursing associate? Because people might be interested in how you've implemented her role in nursing associate, and like sort of what types of things she's doing.
So she now does. She takes the lead in the wound care. So she obviously does all the compression and those sorts of things. And again, going back to the standards, she takes lead in the wound care. So she would do lots of she usually looks after all the patients with them, but knowing that as a registered nurses, we sort of oversee all of that care, but she takes the lead. So she's updating herself, and she comes back and tells us about all the updating, all of that kind of stuff. So she leads it, but we oversee her, if you know what I mean. So there's still that overseeing going on. She's taking a lot more role in the long-term condition management. So she does the atrial fibrillation reviews. She does simple asthma reviews. She's done ear irrigation. The next step for her is to do smears. She does all of the vaccination program apart from child IMS. She hasn't got the courage to do that yet, but maybe that might be next. And actually we're kind of waiting a little while, because we know that they can't work from a PGD yet. They can only work from PSDs. So that makes it quite complicated anyway. So we're kind of waiting to see what develops with the PGDs. She's worked now under the national protocols and giving out the COVID vaccinations and everything. So we know that she can work under them as a consenter as well. So so COVID vaccinations, all of the adult immunisations, leading on wound care, leading on atrial fibrillation, doing some asthma care, and taking a role in looking at the patient as a whole. So instead of it becoming a task orientated job, it's now she's a holistic practitioner, and I'd say that's probably the big change.
Thank you so much, Sarah. So thank you for speaking to us, to give you a sort of round of applause. Great. Okay, so we are going to next speak with, I believe it will be the lovely Rachel Timms. Let me just unspotlight Sarah. And I believe Rachel is going to share her PowerPoint, so hopefully that'll all
fingers crossed
smoothly. Yeah.
Fingers crossed. Always go with fingers crossed. This will smoothly work.
Here we go.
If not,
I have it.
Or
we'll Chris Whitty it.
We're Chris Whitty it. So unfortunately, it doesn't look as if it's going to let me share the sound on a quick video clip that I've got, which is absolutely fine, because I can send the PowerPoint around. It's more important actually probably to have time just to ask us questions, is the way I like to go. So hopefully I'm not sharing my calendar. I'm sharing a slide that's got 4 people on it.
You are indeed.
Excellent. That's always the first way to go. So, and this is where is it going to move? Brilliant. So I have been given, about 4 minutes to talk, because Emma knows me very well, and I could easily fill 40 and not.
I think I gave you 7, Rachel. I think.
Yeah, but see, if I mentally tell myself 4, then hopefully I'll stretch to 7. That's my lot. That is my absolute logic. So Emma and Joe kindly asked me just to come in, just briefly talk about nursing associates. So I thought I'd just take a slight bigger picture and just say that, since nursing associates came in, and I mean, I've got a very hard act to follow, because how do you follow? She's no longer task orientated, she's holistic. That's what we want to do, is in our care, isn't it? Since training nurse associates and nursing associates came into the workforce, actually within the Southwest region, figures as current as they were when I did this slide, which was Monday, are 1,855. And you can see that actually the numbers in primary care are quite small if you look at the slide, but the numbers in primary care are on this very fast high rise trajectory. At the moment, if I look across the region, we've had about, last time I looked at the numbers, which was about 72 hours ago, 72 trainee nurse associates have started their nursing associate journey this year. And that's just been a growing number. It is a generic role, the nursing associate, and during the course, and I won't talk about the course because I know other people will be able to talk about that, it does cover all the fields of nursing. So again, it's that holistic care that can be given, because I'll always give my own example. Within the, my family setup, there's me. I'd love to say I'm in my mid-20s. I'm not. I'm in my early 50s, but there are teenagers, and there's an octogenarian as well. And that comes with a lot of complexities of different aspects of care. Profession is regulated by the NMC. And at the point of qualification, there are, proficiencies that will be met at point of qualification. And as has just been perfectly shared and demonstrated, continual professional development after registration can go in lots of different directions. Apologies, obviously can't show you the little animation, but I will grab it and put it into the chat as well. But we'll send this, well, Emma, can you just share this presentation afterwards for me? That would be perfect.
Yeah, no problem.
Well, I thought I'd just finish my 4 to 7 minutes just in relation to the funding. And this might be where there's further questions that come up. So I will be here for the whole webinar. For each TNA, an employer is eligible for £4,000 a year. So that's it, start of first year and start of second year. And that can be used within settings for how that there's no list of things that it can or can't be used for. That's £4,000 per TNA a year. If a trainee nursing associate, and it depends on some of the different clinic setups or different areas, is working 50% of the time with people with learning disability, there is an increased stipend for that. And because it's an apprenticeship levy, there are, and this is where the questions might come up, there's apprenticeship levy and ARS funding that's around as well. I always stop when I then talk about the funding, because I think that's where some questions might come up, but can always have my point of contact as well with Emma and Joe's, and we can always continue further conversations. And I might have even gone less than 4 minutes for you, Emma, because you were so tight with me. I really constrained myself.
I did want to ask you something actually that I think me and you have actually talked about, that I think is maybe worth mentioning, about the fact that actually, like you said, there's more and more nursing associates out there in the field who are qualified, and that's something to think about recruiting them, because I don't know if primary care are quite there yet, thinking actually I could put job adverts out for a nursing associate.
Yes, and I have noticed more nursing associate posts being advertised across many different sectors that I'm quite interested in how I like to find things out. So I think the NHS job sites, or a lot of job sites, must think I'm permanently looking for jobs, because I've got job filters looking for nursing associates, trainee nurse associates, and return to practice. So I get a daily email with every job that's been advertised from Gloucester down to Cornwall with those titles. So it is interesting to see that the range of employment opportunities. And I'm also a member of a Facebook group, so a TNA Nursing Associate Facebook group. Member might be a bit of a loose word. I'd probably say background lurker is probably the more closer word, because I don't often comment. And it's interesting to see the conversations that are happening between trainee nurse associates and nursing associates about, I work in primary care, or I'm wanting to move into primary care, or I've got a primary care experience coming up. So it's definitely there as a conversation point.
Great, thank you so much. And you'll be sticking around for any questions at the end, is that right?
I am here. I'm just going to do a quick 2-minute disappear, but I will be straight back.
Perfect, thank you so much. I'll do my little round of applause again. Okay, great stuff. So next we've got, I believe, the lovely Tamsin Irving. I'll just spotlight you, and I think she's going to share her own presentation as well.
I don't need to be spotlighted. If
you're spotlighted. You're front and centre now. So if you can share your, are you sharing your?
Yeah, hopefully. Yeah.
Fingers crossed.
There we go. Has that worked?
Lovely. It has worked, yeah.
Okay, lovely. Thank you. Well, lovely to meet you all, and thank you for having me. So my name's Tamsin Irving, and I'm the curriculum lead for the Nursing and Allied Health Department here at Truro College, which actually pre-2020 didn't actually exist at all. So we've kind of come a long way in a very short space of time, but as you know, we didn't really have any provision for any training for nursing in Cornwall. Obviously, we have Plymouth, which is fantastic, and we have, we had a small number of students that could go to the Knowledge Bar potentially for nurse training, but really there was nothing else locally. So really, that's where our journey started, and we were approved by the NMC in February 2020. To offer the Nursing Associate Apprenticeship Programme, first of all. So we're now on our 6th cohort of nursing associates, and we have mostly apprenticeships, apprentices with us, but we also have direct entry students via UCAS, which has opened up even more opportunities for local people and our local students here as well that don't want to go away. So we're so excited to be part of this new role and this new programme. We've had our first 2 cohorts have graduated now, and interesting what you were just saying really about where they're going to work, because they were mostly from RCHT, a couple from surgeries, but some of them have got jobs elsewhere, so not necessarily just jobs in the trust that they've come from. They have got jobs in the community, and some have been really, really interested in working in GP practices, again, really through their placements, so having that placement experience has really opened their eyes to kind of what else is out there. So that's just a little bit about us and where we are really, and we're really excited to be working with quite a few surgeries now. So we've got students with us from Bedruggy, from Foy River Practice, from Westover, we're on our 2nd student from Cairn to Coast, and also hopefully we've got some students coming in January from Stenwick. So it's just so lovely to be working with everybody and knowing that the role is kind of getting out there in the GP practices, because as Sarah said, it really does fit. And I think the more you hear about it, the more hopefully the surgeries will realise how well it fits as well. So I'm not going to talk too much about the actual role, because I think we've kind of talked about that already. But as you know, it is that generic role. It is an amazing opportunity for existing healthcare assistants to progress, as Sarah was saying. And it is that standalone role that, can lead on to a progression route into graduate level nursing if people want it to. But I think it's really amazing that it is that standalone role and a registered, role in its own right. So I think it's a fantastic, role to kind of bridge that gap really between the registered nurses and the healthcare assistants. And obviously we kind of all know why it came about, I'm sure, but obviously everything that's gone on in the NHS in recent times has led us to realise that we need to look at our skill mix and kind of how that role really came about in the first place. As Sarah said, it is a level 5 course, so they do register with the NMC at the end of it, but it is a foundation degree. So, for some people that might be a better option than doing the full 3-year degree. We do obviously, they come out with the foundation degree, which I think is fantastic, and that's why it might be better for some people rather than doing the full nursing degree. Sarah again talked about this a little bit, but if you compare the platforms, the standards between the nursing associate and the registered nurses, it does show that yes, there are differences, but there are a lot of similarities as well. So being accountable and promoting health and preventing ill health, which obviously in relation to GP practice is a massive part of that role as well. But Sarah kind of alluded to this about the fact that the nurses will be assessing the needs and planning the care, but the nursing associates will be more providing, but also monitoring and escalating any problems with that care. Obviously, working in a team is really important, but nurses will be more about evaluating that care, which, we've already talked about. And obviously looking more at kind of improving safety and contributing to that integrated care. And again, the only real difference there again is the nurses will be more about coordinating that care as well. So I just thought that might be useful for us to look at kind of the differences between the two roles. So commitment wise, in terms of the hours, and these hours are set out by the NMC. So the whole programme is basically like half of a nursing degree. So the whole programme is 2,300 hours. Of those, half are theory and half are practice. So there are taught theory hours in college, which are 1,150. And then the remaining hours, those practice hours, are made up of protected learning time in the workplace, which Sarah was talking about, and then 460 hours of those must be in external placements. So it's really important. Sarah was talking about, the commitment required by any employer, but by the surgery in this case, that those hours are, made up, and that they are protected, and that the students are released to go onto those external placements, because we have to monitor those hours really, really closely. And at the end of the day, if they haven't got those hours, they won't register, they won't be able to qualify. So I think, it is important that that is understood right from the start. So the way that we make up the hours is basically, as it says there, really, we put it all into our programme so that it's very clear right from the beginning. And the students are in with us for 2 days a week in college, but not all the time. So I think that's what the practices or the employers like as well, is that they don't lose their employee completely. There are periods of time where they're not in college and they are back in practice. Yes, still with their protected learning time, and yes, still with some external placement time, but they're not with us all the time. So I think that kind of helps the programme a little bit. So I'll just show you just an example of how our programme looks. And I should say we work in conjunction with the University of Greenwich as well. So the degrees that are awarded by the University of Greenwich. Sorry, I forgot to say that. So this is their programme basically. And this is really what they found worked. They did start off trying 1 day a week, but actually looking at what the students have to do, I can see why it went to 2 days a week, because 1 day, I don't know how the students would get in everything that they needed to do. So they are in with us for 2 days a week. So you can see there they would come for a couple of days of induction, then they have a whole block week of theory. And again, that's how we ensure on the programme that they get those theory hours in. So there will be 5 weeks of whole theory over the 2-year programme. So I think that's important to understand as well in terms of releasing the students. But again, everybody gets this programme right from the start for the whole 2 years. So employers know exactly, when the students are here and when they need to be released. And then they have that period of 14 weeks then where they're in college. As you can see, it says term 1, they're 2 days a week in college, and the rest of the time they are back in their employed work with their protected learning time. Then they have a couple of weeks of placement, and then again back in work again. So they're not in with us then until they come back in March. So it's, I think that's, as I said, kind of what employers like about the programme, is that they don't lose the students completely, and there are periods of time where they are back with you, learning in the job and on the job. And all the different placements, we sort those out. So they have to have a generic experience. So they will go and have learning disabilities, they will have children's placements, acute placements, community placements. So I think, again, that's a fantastic, experience. And especially for students that maybe are not even sure where they want to work. As I said, we've had students that have thought about now working in a GP surgery because of their placements. So I think it just opens their eyes and opens the world up to them a little bit. So that's how our programme works and how it looks. And as I said, we always make sure that the whole 2-year programme is given out in advance so that everybody knows what they're doing, and when they're in and when they're out. That just kind of explains it in writing, if you know what I mean, but I think I've probably covered that already. So just the modules. So this is what modules that they do. So you can see there's, we cover everything there, from their professional and academic development, which is obviously really important, their anatomy and physiology, they're delivering and monitoring planned care, that's their skills. So they will do skills in with us in our simulation suites in college, as well as obviously being helped and supported with them in their practice as well. And then they do individual health and well-being. And as you can see, all different ways that they are assessed as well. So hopefully within there, there's something that works for everybody, because we know that not everyone likes exams or essays, but there's different ways of assessing them. And similarly in year 2, you can see there a range of different modules and everything that you would expect them, you know, to be covering basically. So in terms of what needs to be in place for the students, so they do need their maths and English if they've got GCSE, brilliant. So that would be an old C or a new 4 or above. But we do accept level 2 functional skills. They do need ideally a level 3 qualification. And again, that's because they're doing a foundation degree. Having said that, Greenwich are really good and they will accept extensive experience, obviously alongside our successful interview process, instead of the level 3 qualification in some cases. So I think we've had a couple of people so far, a couple of students that we have accepted without the level 3 because they've got, you know, 20 plus years of experience. So I think that's great for the students as well. And as we said, Sarah was talking about this as well, but you're in the workplace, you do need those qualified registered staff to assess and support the students. So the assessors and supervisors. And we also go out and carry out an educational audit as well, which we submit to the NMC. So at that point, if we can identify that maybe there's some assessment or some assessor or supervisor training needed, then we can obviously carry that out as well. And we've done that with a couple of the surgeries so far as well. So it's great that we can offer the training as well. And the employer commitment, as we said, and Sarah talked about this as well, you know, there is an employer commitment. And I think, you know, some of the surgeries that we had right at the very beginning did maybe struggle with that. But I think, I don't know, I think now that everybody's understanding the programme more and understanding what they get out of their students at the end of the day, I think that seems to be lessening now, and people are, you know, getting their protected learning time. They're all being released to come to college, you know, everyone's getting their head around it. So I think that has got a lot better. But it is important for employers to realise the commitment that goes alongside, you know, releasing the students, because as we said, at the end of the day, they just won't qualify if they don't get those hours. So that's just rounding off really the role, and I think they do play a crucial role, and I think the more that we're getting qualified now, the more that we will see that, and the more that we know nursing associates will help our healthcare service, because we all know we all need all the help we can get at the moment, don't we really? So I think, you know, they are a really important part of the workforce. And I think obviously with everything that's new, there's a little bit of, you know, registered nurses worrying that they're going to take the jobs and all of this. But I think, again, I think that's getting less now. And, you know, the more nursing associates that we're getting qualified out there now, I think that is all getting better. And we'll have our 3rd cohort will be finishing. I've got their board next week. So, you know, that's going to be another 20 out there again. So I think the more that we get out there, the better that will be. And just a little quote to finish. Do you like a little quote? So that's just a little quote from a nursing associate, just saying, you know, the importance of the role, really. Thank you. I'll stop now because I feel like I've spoken for far too long. So thank you very much for listening.
Thank you so much, Tamsin. That was great. And will you be staying around till the end? Great. Yeah. Okay, so if anybody's got any questions about that, that'll be great. I'll stop spotlighting you now.
Thank you.
Right. Okay, so let me find. Oh, she was there. Right, Lisa Marie Rowe. We've got Lisa Marie from Plymouth University. So we've got lots of people from Devon here, and also some people from Cornwall who are a bit further up and things, where Plymouth University might be a better option. So yeah, Lisa's just going to talk about University of Plymouth course a little bit. Oh, you muted.
Yeah, I was actually saying to myself, I need to unmute myself, don't I? Hi everyone. So my name's Lisa Rowe and I'm the programme lead for the Nursing Associate programme, and we cover the whole of the southwest of the region. So we've got nursing associates in Cornwall right up to North Devon. And my presentation is slightly different because I didn't want to replicate sort of like the entrance criteria. So what I'd like to do is just to highlight some of the strengths of our programme that we feel really passionate about. We have got some students on our programme at the moment from Cornwall, from GP practices, and we've also got quite a few from Devon and GP practices. So we've had that, but we've really recognised that that needs to grow. And the students that we have just bring such a diverse range of knowledge and skills, because they see such an array of patients, and that's so valuable in the classroom as well. So we're really passionate about the importance of teaching our students about how to learn. And the way I like to describe that is if we could imagine a figure of a nursing associate made of Lego. And I say to the student, that's going to be the finished product. And then as you come along our course and the help you get in practice, it's brick by brick. And we create a structured learning environment and in it to enable them to become, I suppose, the finished product. And that's not overnight. So we try to provide an environment that develops the talents of our nursing associates. And although the programme is half theory and half practice, we clearly say that it's all 100% nursing. So we hear it very much in the undergraduate. It's 50% theory, it's 50% practice. It's 100% nursing. We cannot have theory without practice, and we can't have practice without theory. So I feel very passionately that our job in the university is to enable our learners to see the evidence base. So they might know how, but we want to enable them to understand why. What's the evidence base? So why do I do it like that? They might be very skilled, but they need to know the underpinning pathophysiology, the evidence base, what's the rationale, what situations might this be dealt in a different way. And that's the joy of some of our learners that come in that have got that experience. So if we could say to them, we're going to talk about Parkinson's, and if you've got somebody that's never worked in healthcare before, you're going to have to start by explaining what Parkinson's disease presents itself like. For example, we've got people that have worked in healthcare for many years, and already they've got an idea in their head about what a patient with Parkinson's might present with. They might not understand why they present like that, or how the medications work, the pharmacodynamics and kinetics, but they'll have an idea, and then we're so lucky to be able to build on that and enable their learning. So we use a range of different teaching methods and assessments to enrich their learning experiences, and we use a plethora of pedagogies in order to do that. We recognise that a lot of our learners come from non-traditional learning backgrounds, and that we look to make sure that we're using a range of learning styles and changing those activities really regularly to keep people interested and engaged with the learning, so it's not just autocratic learning throughout. Yeah, so again, we've got vast support in the university for students that maybe have special educational needs. We're lucky to be a big organisation that we've got support there for people with their maths. We have writing cafes, and we've also tried and encourage our students to get involved in the wider university life. So we have interprofessional learning, where we have our colleagues from maybe paramedicine, medicine, the undergraduate, postgraduate, and we're organising interprofessional learning, so that can replicate some of those interactions they have in practice and understand each other's development. We also do sports rounds as well with multi-professionals, which are really good in terms of creating our students' reflective techniques. So we have a massive amount of different skills and profession and specialities that feed into our programme. And one of our students actually described our team recently as compassionate, authentic professionals who act as role models. And they said that they felt that our programme has a very pro-student culture. And that was one of the things that came up in our recent award when we won the Nursing Times Award for Nursing Associate Trainee Provider of the Year. It was about it being a pro-student culture, but also pro-patient. So as you can see here, here's some of our teaching team. And it's just a visual about the background of all our different lecturers, and there's many more that haven't gone on this slide, so that our students really should come out with that diversity that's required for that cross-field experience. Only this week I've been teaching the students about learning disabilities in their place of work, and at the end of it they all came up with an action plan, kind of in the example of an S-bar. So what current provisions do we have in our place of work for people with learning disabilities, maybe trying to access our surgery? What's the evidence say, and what are our recommendations? And then our students went back to their practice managers and came and had a conversation about what they could do to improve that. So maybe that's accessing, getting patients to access their annual reviews or their annual checks, or maybe about advocating the use of a learning disability passport for patients. So we really try to keep that link from practice to theory. And a lot of us still practice. There's me when I go out sometimes at the weekends doing my district nursing. We've also got some of our lecturers that still work in GP practices at least a couple of days a week. We've got patients from lecturers from cardiac theatres, memory cafes. Some of us work in, some of my colleagues work in intensive care and children's wards. So we're still very fresh and we're out there. We're on the coalface. We understand the contemporary issues that you're facing in practice, and I think that makes us. I think the students see us as that we can relate to that. I can't think of the word I was going to say. And here is a little extract similar to what Tamsin said from one of our students who had that came from a practice background. So she said, as I have progressed, I've seen the benefits working holistically, has on building therapeutic relationships and encouraging patient engagement, which can be difficult in a fast-paced clinic environment. A large part of primary nursing care focuses on health promotion and assessment, learning how to communicate and how to encourage patient-led care. And this has been highly beneficial, particularly in performing annual health reviews. Feedback from colleagues has been notably positive, implying I'm providing a more thorough and patient-led review since being on this programme. I additionally have greater knowledge of where to seek further information for both myself and for my patients. That's a really lovely accolade from them. We don't at the moment manage the placements for GP surgeries. This is something that we're looking at doing as an optional basis. So for some GP practices, they might want us to take that on, and that's something the university is planning to offer. But for other GP practices, we found that because of the flexibility of managing their own placements, they have looked about where that fits in terms of their provision over the course of the year. So they're looking at their winter pressures, looking at what times of the year maybe they have lots of holiday, have lots of pressures over the summer holidays, and then they're looking at where they can fit that in. So in order for the practice to still be able to run efficiently, and recognizing that sometimes having one person out of a clinic can make such a difference. So we work alongside them, along with Emma and Jo, and think about how we can support them to get the placements as part of that community of practice. Yeah.
Thank you so much, Lisa Marie. Are you staying on for the next sort of 15 minutes
Yeah.
in case there's any questions? All right, great. I'll spotlight you now, but thank you very, very much. Right, okay, so we've just got a bit of time now to answer any questions. I believe that Jo may have been keeping an eye on the chat if any have come in, but if anyone wants to just raise their hand and ask the questions. But Jo, if you go ahead.
Just a couple of points raised from the chat, really. Fiona has talked about some of the language that we sometimes use about nursing associates and the potential for them to be exploited, I think was the word that she used, once they're qualified, and this, so that we need to be very clear about what their role is within practice once they qualify. And I think, Sarah, you talked about that although you used the word lead in relation to wound care, that was overseen. So assessments would be done by a registered nurse, but your nursing associate would then be carrying on and providing that ongoing care, if you like. So that's an important point, and I raised and I answered that by saying we are, as a region, with Rachel trying to look at some scope of practice guidance around that, which I hope would help address that issue. A question around level 3 qualification, and I haven't got to the bottom of this, from Paula. Care certificate, what level is care certificate at? And I'm afraid I don't know that. I could find some examples of level 3 qualifications. Can anybody answer Paula's question there? I don't think care certificate is no, it's not. So that I can see Tamsin shaking her head there.
I mean, yeah, I don't think it's the equivalent of a level 3. We've never accepted that as a level 3. I don't know if Anne-Marie has, but I don't think that that's the equivalent of a level 3.
Okay, so but Paula, I've given you some examples of what fits under that heading there.
It's just also worth. Oh, sorry. Oh, I was just going to say it's also worth noting that sometimes people think they haven't got a level 3 qualification because they don't have one in healthcare, but they might have done a degree or something like that in something completely different years ago, and it's about being able to study that to that level, not that it's specifically in healthcare or something that applies to nursing associates. So it's always worth asking, have you ever done any any course at a higher level? So sorry, Rachel.
Yeah, mine was just in relation to come and be the care certificate, because I've similarly been looking at this. Most care certificates that are undertaken are care certificates of professional development. They're not then mapped in relation to educational academic levels. There is the general practice, I think it's the GPA certificate, which does map to 10 UCAS point entries, but that's quite a specific course, but that wouldn't allow much reduction on consideration of APEL, which is, I'm gonna forget the abbreviation. I've never used an abbreviation if you can't remember it.
Accreditation of prior something learning,
yeah. Experiential learning. But yeah, the care certificate, most, unless they have them being validated through a further or higher education centre, don't come with academic credits.
Thank you. I think that covers Paula's question. I think then Sarah, you've got your hand up, and then I think Fiona afterwards.
Yeah, I just wanted to come in about the point that Fiona rightly made about not knowing, not everybody knows what a nursing associate is or what they do, and that is getting more and more. We're knowing more and more about it, and the platforms and the standards are more readily available. But you're right, and I think that not everybody is going to be reading those standards and getting to the nitty-gritty of what the nursing associates do and what the registered nurses do, and employers, practice managers who haven't got a clinical background may well easily think, pin, off you go, and we're the same. And I think it does very much come down to your lead nurses to be the advocate for the nursing associates and being able to say, no, these are different roles, and we really need to make sure that they're protected. Yes, they've got a pin, and they do need to stand up for themselves and advocate for themselves as well. But you're right, I had to do quite a lot of education even within the nursing team, and then within the wider general practice. And luckily, my practice is is good at listening and wants to make sure that everyone is happy within their roles. But I can see the point, and I can see that there, with the pressures that are on, with the things that we're asked to do more and more, how they could be put upon. So there is a need for someone to be able to advocate for them.
Fiona, would you like to come? You've got your hand up too.
Yes, I have. Sorry, I'm having to go in a minute for a clinic, but thank you for addressing that. I mean, like I said, I'm very much supportive of nurse associates, but I do think that this is a band that's been introduced without a lot of thought about how it's different in general practice. And Sarah's absolutely right. It requires not just an incredibly aware team, but also for the nurse associates themselves a very heightened awareness of the limits and boundaries of their competence. And I just think that Health Education England and the NMC could do a lot more to provide written guidance on that. I actually put my hand up for a different question, which was to ask the education providers whether we have any documented statistics on how many people are coming through and then upskilling to registration, because I think that's really important to know as well. My guess is not that many, because they're pretty exhausted by the programme, but it would be really good to see this as a way to registration.
Yeah, hi Fiona. We definitely have seen quite a few on our undergrad programme. We seem to have a bit of a come back on the audio, sorry. And we've seen last year 4 students went on to do children's nursing, similar went on to mental health training, and then we have, because I think we had maybe 20 on our undergraduate programme, which is really great. But I just wanted to go back to your normal your previous question, and actually we do some work with our nursing associates about what they're able to do and how to educate where they are about what's within their role and what's not, and that comes into our assessor and supervisor training. But also our nursing associates are actually, when they finish the 2-year programme, they are trained as registered as academic assessors and supervisors, so then they can go out and support the next round of nursing associates. So I think they can then go forward and continue to advocate that role and advocate that for the up and coming nursing associates as well. We did see a massive surge in people wanting to do their undergraduate. I think it was something like 40 to 50% of a cohort, but some employers have asked them now to spend a couple of years consolidating their nursing associate before they're willing to support them further. So I don't think that's so much of a student decision, or more so that the employers are asking them to hang around for a little bit to make sure that, you know, before they support them further.
Yeah, we've got the same. I think the cohorts that we've had finishing, that I would say half of them want to come back, and some of them actually from our September 2020 cohort are actually joining halfway through our year 2 RNDA programme, but they're actually funding themselves. So Anne-Marie's right, most of the employers are saying they need to consolidate for, I think the trust, RCHT, is saying at least a year before they would support them via an apprenticeship route to kind of top up to the full nursing degree. But some of the students are actually choosing to come and fund themselves. So it does show that there's a lot of them that actually just really want to do it and want to come and kind of do it straight away. So it's interesting though, isn't it?
Just on that front as well, Fiona might be interested here that it's only in the last few weeks, but there is going to be hours funding for nursing associates if they choose to upskill to registered nurses. So there is actually going to be funding for that now. So it's a real route into them becoming nurses through an apprenticeship. So that's hopefully going to be good, an option for a lot of people. Rachel?
Thank you.
I just wanted to add on to that, the trends we're seeing looking over like a 5-year period is the numbers that are wishing to then go on to do their registered nurse is coming down. It was like high 70-80% at the beginning, and that's because when nursing associate and TNAs was first, you know, put out as a concept, it was very much, and you could then go on to be a registered nurse. But while these other conversations around scope of practice and scope of competence and scope of capability are happening, and I am in meetings with the NMC and the CQC and across regionally looking at all of this across different care sectors as well, there is this growing body of registered nursing associates that are like, actually, I'm a nursing associate and I have done my 2-year and I am very proud of who I am, and I don't feel I need right now, for many reasons, professional and personal, to go on and do my RN nursing. So it's a trend that we've seen change as well. So I just thought I'd come in with that one. So that was a rounded from individual to local to big picture.
Thank you for that, Rachel. Just to pick up a couple more from the chat, Sharon, who is based in Cornwall, is asking about sometimes it's difficult for GP practices to ensure securing placements. Is there any help? And I know Emma and I are working, you have a placement coordinator who is helping to TNAs now in Cornwall, as do I in Devon. So I think the answer to that, Sharon, would be yes, we've acknowledged the problem and we're doing our best to support that across the patch. But clearly, yeah.
Oh, sorry, I was just going to say what we've been doing with our GP practices is kind of reciprocal placements. So Michelle Robertson, who works in the trust, she kind of organises all of the placements for all of our apprentices. So she kind of does a reciprocal arrangement with the GP. So when theirs are out, they agree to have you know, another TNA in there. So that seems to be working. So that's what we've been doing so far.
Yeah, and that's great, but it does vary across the patch, the
Yeah,
different
I was
education
just going to
providers.
say,
Yeah,
it does vary.
and clearly we've got representation from 2 education institutions. There are
Yeah.
others available across the
Yeah,
patch,
of course.
and each take a different approach. So for
Yeah.
those where it becomes an employer responsibility, I think that's perhaps where Sharon's question came from.
Yeah.
And Emma and I are doing our best to support people where that is an employer responsibility, and is then sometimes a little bit more difficult if you haven't got links there. We've
Yeah.
had some questions around pay band, some of which have been answered between yourselves. Sorry, Emma, did you want to come back in before I moved on?
Yeah, I've forgotten what I was going to say now. So you can just
Okay,
continue.
all right. So pay band, clearly within general practice, that can be very varied. Ours role funding will match Agenda for Change Band 3 for a trainee nursing associate and a Agenda for Change 4 for a nursing associate. So I think that's probably the best way I can answer that question. But as Fiona has rightly said, it does depend a little bit on the employer. I've got a question about, does the university have a minimum age that students can start? We have had 16-year-olds apply via GP recruitment. I don't know.
It's 18 with our university.
Yeah,
It
18.
needs to be 18 because
Okay.
of some of the interactions.
Sure. So Annika, we're going for 18 on the patch here. And then top up from nursing associate to registered nurse. I think that would depend whether you did it full-time or part-time, to answer Paula's question there. Would that be a fair response, Lisa?
Yeah, if it's full-time, they join our program. So if they finish their nursing associate, for example, at the end of the summer, they would then join our program at Christmas. So our program's been mapped to the nursing, our nursing associate program and the undergraduate program are both mapped, so the modules are transferable straight across.
Yeah, that's the same with us because the modules are mapped across. So they join with us. It works out as March because that's like halfway through year 2. But it is 18 months because it would be half of like the 3-year program.
Or a lot longer if it was a part-time route through that.
Yeah.
Yeah, we do offer the part-time as well.
Yeah. Couple of people have to leave, so that no other points from the chat there. Emma, you still got your hand up. Is that an old hand? No. Any other questions anybody would like to ask?
Oh, can I just say something about the reciprocal placements? It was just mentioned earlier because that was I was going to say and it popped back into my head. I think wherever you're going to go, it's strongly encouraged that you would do reciprocal placements, because if you are going to send someone somewhere for a placement, it's quite right that you would take someone back. But actually there's an opportunity in that, because like I think Tamzin and alluded to, you know, these nursing associates, once they're qualified, they could then decide that they want to come and work for primary care. And that's what happened with Martin Davey, who was going to speak today but was unwell, unfortunately. You know, he was actually trained by the hospital somewhere in Somerset, I believe, and he ended up then being recruited by the GP surgery that he did a placement at, and he does lots of work there now and he's absolutely loving it. So, you know, that's the opportunity in having placements, and I believe the requirements aren't as demanding as the registered nurse placements when you have them. It's slightly different, so it is a worthwhile thing to do, and that's all I have.
Thank you. Paula, you've asked about 30 hours. Is 30 hours mandatory for? I'm guessing your apprenticeship requirements are that an individual to access an apprenticeship program needs to work a minimum of 3 hours. 30 hours. They need to be employed for a minimum contract of 30 hours. So I hope that answers your question there, Paula. So it can be above that, but it can't be less than that. And Sarah's given the example there that her TNA had to increase, and I've had experience of that, where their TNA has had to increase their hours. Their HCA may have been working less hours before, but they've increased that to complete the apprenticeship course. Okay.
But importantly, that can be that will be covered if you have money left through the hours funding. So you know that salary can be backfilled. So that's the perk of the hours funding.
Can I send details regarding the part-time course? Paula, is that the part-time top-up course? In which case I certainly can. I'll tell you what, Paula, I will email you afterwards, okay? And I'll pick that question up because I know Paula's based in Devon. and we are bang on 2 o'clock. Thank you very much all for your time. Emma and I will now put our contact details in the chat. If there's anything anybody wants to contact either us about, me for Devon, Emma for Cornwall, we would be more than happy to help. So then please do get in touch. Thank you very much. Thank you to all our speakers as well. Apologies, that should have been my first thing, shouldn't it? Thank you very much to all our speakers.
Thank you very much, everyone.
Yeah.
Thank you.